So the article that I've chosen involves researchers finding a potential new cell that may treat heart failure. So heart failure is a major problem in our society today, being the main causes of morbidity and mortality worldwide. Cardiovascular disease was responsible for nearly 44,000 deaths in Australia in 2012. But what is heart failure? Heart failure is a physiological state in which cardiac output is insufficient to meet the needs of the body and the lung. There are two different types of heart failure. One, heart failure due to reduced ejection fraction, also known as systolic heart failure. And two, heart failure with reserved ejection fraction, also known as diastolic heart failure. Heart failure with reduced ejection fraction occurs when the ejection fraction is less than 40%. Ejection fraction is the proportion of blood that is pumped out of the heart during a single contraction. It is given as a percentage, with the normal range being between 50 and 75%. In diastolic heart failure, the heart muscle contracts well, but the ventricle does not fill with blood as well in the relaxation phase. So what are the common causes and symptoms of heart failure? Heart failure is more likely to happen as we age, but anyone can develop heart failure, which is a serious long-term chronic condition. So heart failure may occur due to a number of different factors. Most people who develop heart failure have or had a previous heart condition. The most common conditions that can lead to heart failure are coronary artery disease, high blood pressure, and previous heart conditions. Another way that someone may experience heart failure is due to viral infections of the heart. These infections may lead to inflammation of the muscular layer, causing damage to the heart. There are also a variety of symptoms that are associated with heart failure. These symptoms include shortness of breath, the buildup of excess fluid in body tissues, persistent coughing or wheezing, lack of appetite or nausea, excessive tiredness, and also increased heart rate. So what is this treatment? Currently, stem cell-based approaches to cardiac regeneration are increasingly viable strategies for treating heart failure. The problem, however, is generating abundant and functional autologous cells for transplantation. In this article, the researchers focus on cells in the heart called cardiovascular progenitor cells, or CPCs for short. CPCs are naturally produced as the heart forms in the embryo and go on to form specific cells, which include cardiomyocytes, endothelial cells, and also smooth muscle cells, meaning that they have a restricted cell lineage. This restricted cell lineage means that they have a loss of multipotency, which is usually accompanied by a decreased capacity of cellular proliferation. So the researchers thought that by isolating CPCs that can extensively self-renew and possess multiple but restricted potentials to directly differentiate into the three cardiovascular cell types, they can encourage the development of more effective and potentially safer therapies for cardiac regeneration. So researchers have examined multiple combination of signaling pathways involving in cardiogenesis and developed chemically defined conditions to identify a specific type of CPCs that are reprogrammed from fibroblasts. These new cells are called induced expandable CPCs, or IECPCs for short. These IECPCs are able to extensively self-renew themselves, and they are restricted to a cardiovascular fate, meaning that they directly give rise to cardiomyocytes, endothelial cells, and smooth muscle cells, without stepwise differentiation. These induced expandable CPCs can robustly self-renew for more than 18 passengers and still maintain their morphology, gene expression pattern, and multiple but lineage restricted potentials to differentiate into the three cardiovascular cells within the heart. The researchers conducted an experiment on mice who had suffered from heart attacks to see if these cells could be a viable method of treating heart failure. These injected mice with a solution containing these CPCs saw that 90% of these new cells spontaneously transformed into functioning heart cells, creating new blood vessels and generating new muscular tissue. They were also able to see that heart function was improved in the mouse for at least 3 months. This shows how IECBCs are a powerful system to study cardiovascular specification and provide strategies for regenerative medicine in the heart. Thank you.